Volunteer service under the impact of the COVID-19 epidemic, a regional hospital of Taiwan as example author Jenny Yu Social Work Division, National Taiwan University Hospital Hsinchu Branch, Taiwan. After the outbreak of COVID-19, the lives and health of people all over the world have been seriously threatened. In May 2020, the epidemic situation in Taiwan became severe. Therefore, part of the volunteers left from our hospital. Without the caring service of volunteers, patients and their families in the huge medical system can only rely on themselves to explore the direction, and cannot get initial and immediate assistance for the difficulties encountered in the medical process. Regarding the loss of volunteers, social workers used several measures to attract volunteers to return. During the recruiting session, we took the initiative to inquire about volunteers who would like to return to service. Volunteers are then scheduled to be vaccinated. And we also arranged safe and proper equipment ready for works. At service locations, which have been adjusted from high-risk areas of infection, such as emergency rooms, to low-risk areas, such as outpatient clinics. In terms of service content, it has been adjusted to patient diversion control, TOCC inquiry, and assistance with vaccination station services. After these adjustments, 50 volunteers returned in the initial stage, and now there are 190. During 2020 to 2021 period, 3,833 volunteers joined the outpatient service hall, assisting the hospital in diversion control and inquiring about TOCC for about per day 2,000 to 3,000 outpatient visits. At the same time, volunteers also supported vaccine administration in hospitals and high school campuses, serving 7,000 students. Supporting Hsinchu Science Park enhanced new coronary pneumonia screening station, serving 1,250 Science Park personnel. Volunteers also assisted make 6,000 sets of medical protective masks, so that medical work can maximize its function. In 2021, after two planned surveys conducted by an external company in April and October, patients and their families were satisfied with the hospital volunteer service at 94.2% and 96.3% respectively. In October, an increase of 2.1% indicates that the effectiveness of volunteer services is good and continues to improve. Under the impact of the COVID-19 epidemic, volunteers still can come back a safe environment of the hospital. Participating in and providing services, in addition to enabling volunteers to achieve their goals of self-growth and social participation, volunteers' support can also maximize the function of medical work. The most important part is that patients and their families can feel attentive service and immediate help. The hospital volunteers still play a great role under the impact of the new crown epidemic.